it's good that I can feel people's pain. It would be even better if I could transform one's pain into soothing relief. These words of my father nourished and nurtured the divinely planted seed in me to become a compassionate healer, and my journey with Ayurveda, the science of life, began. According to Ayurveda, our Panchabhautik body is an amalgam of space, air, fire, water, and earth, and solution to all chronic ailments lies in balancing these body elements. As the origin of Ayurveda goes back to thousands of years, so some part of our ancient historical knowledge is lost. That's why I started my own research and shared it with the world. Ayurveda can give very quick recovery, even quicker than allopathy, in most chronic ailments.
The blend of Ayurvedic medicines, Panchkarma, yoga, diet has helped Dr. Nadeep Sharma create the brand Risht Pusht and Team Nirogam by treating thousands of patients suffering from chronic illness. Join Dr. Nadeep Sharma's guided path of healthy living. Call now at +1 888 624 5925.
All of you in this live interactive session of ours where we generally try to discuss quality Ayurveda with you, and while we are discussing Ayurveda with you, we also try to take the maximum of your questions. हमारा प्रयास रहता है कि आयुर्वेद के माध्यम से आप सबके साथ जुड़ा जाए इन लाइव सेशन से, और जिस विश्वास के साथ आप आयुर्वेद की तरफ अग्रसर हैं, जिस विश्वास के साथ आप हमारे साथ हैं, किसी भी दूसरी ऑर्गेनाइजेशन के साथ आयुर्वेद का इलाज करवा रहे हैं या आयुर्वेद की मदद से आप अधिक स्वास्थ्य रहना चाहते हैं, हमारा प्रयास रहता है कि हम आपको सही जानकारी दें आयुर्वेद के माध्यम से। इसी रिगार्ड्स में हर वेंसडे को आपके साथ मैं स्वयं जुड़ता हूं और कोशिश रहती है सही गाइडलाइंस देने की। हमारा सबसे पहला प्रयास आप लोगों के क्वेश्चंस लेने का होता है। योर क्वेश्चंस आर ऑफ अटमोस्ट प्रायोरिटी टू अस, और उसके दौरान जब कुछ समय लग पाता है तो डेफिनेटली हम कुछ कॉमन चीजें भी आयुर्वेद की हमेशा डिस्कस किया करते हैं। यहाँ पे मैं देख पा रहा हूँ कि मेघा जी, आपने अपना क्वेश्चन जो है यहाँ मेंशन किया है। मेघा जी, आपने लिखा है कि हाय, I am mom of 14-year-old son who have autism with 50%. He has good eye contact since childhood, but he is premature born at 7 months, completed normal delivery with suction cup. Megha ji, as you just mentioned that 50% things he is doing perfectly, and there are 50% problems that he is facing. I would really appreciate if you can write down for me the exact concerns, like is he being more hyperactive? Is the cognition part on the lower end? So if you can detail the things up to some extent for me, that will make my task easier, and I will accordingly be able to guide you. What I can guide you in the beginning itself is, yes, there are herbs in Ayurveda which can be helpful for him. At 14 years of age, if a child is severely autistic, it becomes tough for us. But if a child is able to do a lot of new things, then it comparatively becomes possible for us. So please share some details with me. देखिए, आयुर्वेद में जब हम ऑटिज्म की बात करते हैं तो I generally divide the life of a child into various phases. Below 4.5 years of age, when we talk about a child, the child is at a reflex language development age and a reflex learning age. Now that is the age where a child will learn very quickly from the world around him. That is why a child, when the child is at a reflex language development age, a Gujarati child will speak Gujarati, he will learn Gujarati, a Bengali child will learn Bengali, and similarly for any language. So it is a reflex language development age. So if a child comes to us below 4.5 years of age, the results are very quick and miraculous. From 4.5 years to 12 years, the child is at a trainable age. So from 4.5 to 12 years, the child is trainable. If the parents, they associate with us, they start doing what we guide, again a child can completely come out of autism. At 14 years, I won't say that the child will be able to completely come out of autistic phase, but yes, there are lot many positive changes that are possible to be brought in the child even at the age of 14 years. So you have mentioned that he has sensory issues with finger flapping, biting hand. Megha ji, these are workable things. Please mention if you are doing any kind of applied behavior application for him, and if you can share some videos on the helpline number which are given over there, which are mentioned over there, that will really be helpful and appreciated. and all of you who are there on the live session. Seema and the team members, please do remember anyone who is there on the live session, and we are not having any coordinator who has been allocated. So immediately please allocate a doctor who can guide the patients. And all of you who are joining us, Megha ji, you, Vijay ji, and all of you, if you have been allocated any patient code, I would really appreciate if you can mention the patient code. If you don't have the patient code currently, you can mention the registered mobile number for us, where our team knows then that what has been guided to you and what needs to be done from your end. So Vijay ji, you have mentioned that, sir, my child is 4.5 years old, and Vijay ji, as I just mentioned, that means that the child is now moving on from a reflex language development age to a trainable age. So are you doing something for the child? Any kind of ABA or OT or speech therapy or anything which is being done for the child? Please do mention it for me. प्रीत जी, आपने कहा सर मेरे नेफ्यू फुल सेंटेंसेस कब बोलेगा? स्पीच तो आ गई है आपकी मेडिसिन से। प्रीत सिंह जी, बहुत बढ़िया है कि अब स्पीच आ चुकी है। फुल सेंटेंसेस के लिए भी हम एबीए से जरूर वर्क करेंगे, आप बिल्कुल निश्चिंत रहें। देखिए, कुछ चीजें हैं जो दवाइयां करती हैं, कुछ चीजें हैं जो हर्ब्स करती हैं, और हर्ब्स क्या करती हैं? हर्ब्स का काम है कॉन्शियस और सबकॉन्शियस की कोऑर्डिनेशन को बढ़ाना। कॉन्शियस माइंड को अगर वो कम वर्क कर रहा है तो हम हर्ब्स के यूज से उसकी परसेप्शन को इम्प्रूव कर सकते हैं, बच्चे की कॉन्शियस माइंड पे काम करने वाली हर्ब्स का इस्तेमाल करके। ठीक इसी प्रकार से अगर सबकॉन्शियस माइंड जो है, सबकॉन्शियस माइंड के ऊपर हमें वर्क करना है तो वो भी हर्ब्स के साथ किया जा सकता है। लेकिन जब ये दोनों वर्क कर दिए जाते हैं तो साइड बाय साइड अप्लाइड बिहेवियर एप्लीकेशन, एबीए इज वेरी इंपॉर्टेंट। वो बहुत जरूरी है उस पॉजिटिव माइंड कोऑर्डिनेशन को इन द फॉर्म ऑफ वर्ड्स, इन द फॉर्म ऑफ बिहेवियरिस्टिक चेंजेस लाने के लिए, वो नहीं मिस करना है हमने। बहुत बार द पेरेंट्स दे गेट कंफ्यूज्ड इन दिस थिंग, दे विल टेल अस दैट सी वी आर गेटिंग ABA डन फॉर आवर चाइल्ड। Please do remember, nobody can do ABA for your child. It is you as parents or the grandparents or those who are there with the child at home can do the ABA. So we generally believe in guiding and training the parents. They are trained and then they do the ABA for their child. Megha ji, आपने लिखा है memory is few part good and Kayan, the ID is there. So it's a request to me, Seema, as I just mentioned, the doctors are there. Dr. Ruchi, you are over there. Please do remember. Dr. Naprit, please do remember. For all patient codes where coordinators are not over there with us and the patient has mentioned the patient code, immediately a doctor needs to connect with the patient to guide over there. उम्मीद के साथ परमात्मा से यही दुआ करते हुए कि आप सभी लोग रिष्ट पुष्ट रहें, मैं डॉक्टर नवदीप शर्मा आपसे आज्ञा चाहता हूं। हमारे साथ जुड़ने के लिए बहुत बहुत धन्यवाद। नमस्कार।
Call now to connect with world's senior most Ayurvedic healer, Dr. Navdeep Sharma, and gift your child autism-free life.